Hi everyone, this video is the presentation of my capstone project for course MIS 581. My research topic is modeling the COVID-19 prevalence and hospitalization in Alberta, Canada. Let's start with the agenda. The content in this presentation contains very few technical terminologies and intended for anyone who cares about COVID-19 situation in Alberta, and also for the decision makers from the public health and municipal sectors. It'll start with background of the research, followed by the COVID-19 dynamics from March to the end of July. Then we'll use the reproductive numbers to quantify the intensity of the spread. Finally, short-term projections between July 28th and September 9th will be presented. The last slide elaborates more on the model parameter determination and estimation. It's more for the fellow data analysts who are also interested to customize model and fit it on their own COVID-19 datasets. For people who are not familiar with the province of Alberta, a brief introduction is for you. The total population of the province is 4.4 million in 2020, and more than 50% of them live in the two major cities, Calgary and Edmonton. Alberta's economy is still largely relies on oil and gas industry. As you can see in the bar chart, of the top 15 crude oil production regions, Alberta ranked 7th place and accounted for about 70% of the total production of the country. Alberta is also famous for its top-rated ski resorts, national and provincial parks in the Rocky Mountains, which attracts millions of travelers around the world. But the beautiful province is facing double crisis during the COVID-19 pandemic. In March 2020, the oil price war between Russia and Saudi Arabia drove the crude oil index to the lowest level in history. Oil and gas companies here started to suspend their productions and laying off employees. Like many other jurisdictions in the world, Alberta was in lockdown due to the COVID-19 pandemic. That's from mid-March to mid-May. The crisis reflected on the unemployment rate, where you can see in March, the number was 8.7% and hiked up to 13.4% in April and continues increased to 15.5% in May and June. The province started staged relaunch from May 14th. Most public services and business are allowed to reopen with reduced capacity and meeting other public health requirements. Let's take a look back at how have we been doing in controlling the pandemic. The first case of COVID-19 was reported on March 6th. The province took very early restrictive interventions, and on March 17th, the province declared public health state of emergency. That's when schools, non-essential business, and even elective surgeries were closed. The first peak arrived around April 30th with about 3,000 active cases. The numbers quickly declined to the lowest level in early June at around 300 active cases. If you notice, there are numbers says R0 equals 3.02 and RT equals 0.51. What that means? Well, the R is short for reproductive numbers to describe the intensity of a communicable disease. Actually, R0 is pronounced R0. So in the COVID-19 context, R0 equals 3 means at beginning of the community transmission, on average, one infected person during his, say, 10 days of infectious period, he was able to pass the virus to 3 other people. RT is the effective reproductive number. Again, in COVID-19 context, that's when interventions were in place and the number started to drop. The secondary cases arise from the single case. RT equals 0.51 during the lockdown period in Alberta means the spread was very well under control and the number of active cases dropped 90% within a month. The prevalence is just another word for active cases at a given point in time. In the following slides, we'll only use this metric to describe the COVID-19 dynamic. The relationship between reproductive number and prevalence is when RT is greater than 1, the number of active cases will grow exponentially, like this curve. And when RT is smaller than 1, that means the spread is under control, and it will dissipating in the community. Now we have seen the RT can be used to assess effectiveness of public health measures. Let's move on to the relaunch period to see how did we do during the stage 1 and stage 2 period. In this study, we applied an epidemic model to each relaunch period to estimate effectiveness and the effective reproductive numbers from May 14th to June 11th. And the RT was estimated at 0.515. That's a little bit higher than the shutdown period. However, starting from the stage 2 relaunch, and from June 12th to July 27th, that's the latest data we used in this model, the RT was estimated at 1.579. How bad it was. And as of July 27th, the active cases increased from the 500 in May all the way up to 1,400. Along with the economy relaunch, we're expected to see more cases. But what would numbers will look like a month and a half from now? This brought up our research question, which is, what are the projected daily active cases of COVID-19 by each AHS zone and total hospital bed demand from late July to early September 2020? We know our economy cannot afford a shutdown for too long, and COVID-19 is not going anytime soon. To balance between the protecting the population and supporting the economy, more information is needed for the decision makers to determine if we should regress some of the previous measures or to ease off some of the restrictions. Albertans also have all these questions about every aspect in our day-to-day lives. Hopefully, this short-term projection could answer some of your questions. Before we present the projection, we first introduce the need for the fine-grained models for each of the Alberta region instead of just one model for the whole province. Well, let's take a look at province time series graph. We can see Calgary always had the most active cases in the province, and its cumulative cases actually accounted for more than 60% of the cases in the province. While Edmonton is the light yellow here, has similar population as Calgary, but it only has less than maximum of 300 active cases that's happened recently. In the South Zone, in this blue color, there were clearly outbreaks at beginning of May. Otherwise, the three rural zones were stay relatively stable at the bottom of the graph. So we need separate models to fit on the 5 different data sets from different regions to estimate the RTs for each of them. In the projected prevalence from July 28th to September 9th here, we can see Calgary could have close to 3,000 active cases by then, and has count more than half of the active cases in the province. The North Zone would have the lowest number in active cases, at around 300 cases. The total hospitalization in the province could reach 900. The model assumed that in stage 2 reopen restrictions are in place in the near future, and the travel restrictions, border closures are still hold still, and the schools are still closed for summer vacation. As we see the rapid growth, we need more control at board measures, ideally at municipal level. We have seen some approaches, such as Calgary passed bylaw of mandatory masks for indoor public spaces and transportation. That's a good starting. If you think the numbers don't look too bad and not convinced by employing more restrictions, let's take a look at a longer term prediction into March of 2020. This is somehow we holding the RT as of now, which is ranges from 1.3 to 1.7. So each region will likely to reach their peak in January 2021, when the active cases could reach from 10,000 to 85,000. Of course, this is unrealistic prediction because the situations and measures keep changing. And that's why we need frequent short-term predictions to adjust to the situation. This last slide is provided to the fellow data analyst with details about the epidemic model, including how to customize it, how the parameters were determined and estimated, as well as tips and notes on how to fit the model to the real world data sets. It's been a lot of information, and the takeaway for everyone is in Alberta, since the stage 2 relaunch, COVID-19 is spreading rapidly despite of schools closed and travel restrictions. We need more interventions at region level to control the spread. This concludes my capstone project. Thank you for watching. Bye.